This is a PSA about treatment-resistant depression and anxiety. It is a very common type of depression that often goes unspoken about. It affects people of all ages and is especially distressing. Johns Hopkins notes that treatment-resistant depression affects about 30% of people diagnosed with major depressive disorder, and severe depression symptoms can take a particular toll on younger people. They also note that finding effective depression treatment in youth and young adults is critical when young people are making decisions and developing habits and coping mechanisms that can affect their life trajectories and preparations for their futures. Treatment-resistant depression and anxiety happens when you're diagnosed with depression and despite treatment, symptoms persist and have not improved. According to Mayo Clinic, for many, taking an antidepressant or going to psychological counseling eases depression symptoms, but with treatment-resistant depression, standard treatments aren't enough. They may not help at all, or your symptoms may improve, but continue to come back. Columbia University also adds that individuals are considered to have resistant depression if they haven't responded to an adequate trial of 2 different SSRIs or antidepressants. Studies indicate that 29% to 46% of patients with major depressive disorder show partial or no response to treatment. I personally started exhibiting depression and anxiety when I was 18. I tried multiple different SSRIs, talk therapy, and saw multiple specialists to no avail. I eventually developed very bad anxiety that progressed into extreme panic attacks and it was accompanied with serious bouts of insomnia. It affected my relationships with my family, my husband, and my friends, and eventually prevented me from functioning to the best of my ability. I lost jobs and dropped out of school for a period of 5 years. Thankfully, I had an incredible support system, and in tandem with them and professional help, which I will break down a little, I started to overcome my treatment-resistant depression and anxiety. Some of the things that helped me were reviewing all medications I had tried previously. I completed a physical and blood work to rule out any psychological issues, and worked with professionals who specialize in treatment-resistant depression and participated in ketamine treatment. To break it down further, CBT was also helpful, which is cognitive behavioral therapy, and it helped tremendously. According to the American Psychological Association, it is a treatment that usually involves effort to change thinking patterns. There are many ways to tackle treatment-resistant depression and anxiety, and if you are struggling, one of the best resources to find help is using psychologytoday.com. And although in name, this form of depression is intimidating, it is manageable if you have it and can find the correct resources. I also recommend having a steady hobby, which for me, I bead, I make earrings, and I recommend having a dog. Dr. Cook! Treat, Dr. Cook! Doctor! He's a perfect puppy.